our study evaluating the safety and efficacy of Trikafta in 2 to 5-year-olds was very helpful, I think, and I hope will support the registration for its use in the 2 to 5-year-olds in Brazil. First of all, in terms of safety, we found a very similar safety profile to that seen in older patients, and also to that seen in ivacaftor in 2 to 5-year-olds. So there was, for some individuals who had elevation of liver function tests, so that definitely needs to be monitored routinely. But I didn't review the paper right before now. I think there maybe was one patient who had to stop and restart, but overall the safety profile was very encouraging. There was one child who had some behavioral changes, but it was not clear that they were due to the drug itself, because they had had some behavioral differences before initiating Trikafta, so it was felt to be possibly related. Other than that, it seemed to be quite safe, and again a similar profile to the older patients. And then in terms of efficacy, we saw a very dramatic reduction in sweat chloride, greater than that in older patients, and that's been seen in ivacaftor as well. And then we also saw a clinically significant improvement in the lung clearance index, which I think is very helpful for thinking about long-term benefits in terms of lung function. We did not see a dramatic improvement in weight or height, because these patients were already doing very well from a nutritional standpoint, so that was maintained over time. There were a few patients who had some improvement in fecal elastase, but looking at the group as a whole, we did not see a significant improvement in fecal elastase, which is a little bit different from ivacaftor, and not exactly sure why that is. I think the key thing about initiation of Trikafta in the 2 to 5-year-olds is not so much in terms of short-term benefits, because these children tend to be outwardly facing very healthy already, but in terms of minimizing long-term disease progression. So really keeping an eye on helping them to be healthy until they're 40, 50, 60, 70, 80 years old. I think that's really the long-term difference is what we see.